Hi, I'm Marta Vaz Batista. I'm a medical oncologist in Lisbon, in Portugal, and I also work in investigation in clinical trials, specifically in breast cancer. Is an investigator initiative trial, which means that the idea came up from me and Dr. Sofia Braga in the first place, because we are seeing a lot of patients in our clinic with brain metastases from breast cancer, and we felt like the answers we have to give to these patients are not enough and are not that satisfactory. And with this clinical question in mind, we designed a trial that is the DEBRA trial, and the trial was then presented to MedSeer, and this was the path we worked since then. In this trial, we decided to include not only patients with brain metastases, stable brain metastasis and unstable brain metastasis, which means metastases that are progressing after local therapies for the intent of this trial. But also we decided to include a very specific cohort. It's the cohort with leptomeningeal carcinomatosis, because in our clinic we had a few cases of leptomeningeal carcinomatosis in patients, specifically with HER2 positive tumors, and we were confronted with the reality of having very less to offer to them, and very few studies and very few data on the efficacy of some of drugs in this setting, and that was why we also included a leptomeningeal carcinomatosis in our trial. DEBRA's trial addresses in here a very important question, that is the efficacy of a specific drug in patients with brain metastases, and on not only the first patients included in trials, like the ones with stable brain mets, but also we introduce it in here even before we have some results of bigger trials, the concept of brain metastases that are progressing after local therapy. And we did specific cohorts for these patients to see if the drug we are testing are also has efficacy in these patients. Also, we tried to do something that we felt interesting, that is testing a drug not only in HER2 positive breast cancers, but also in HER2 low expressing breast cancers, because the drug we are we are using, also seems to work in this population. And so we tried to have these two questions addressed in our trial. Since we have so few information in this clinical setting, I think that we always add something. And specifically for cohort 5, that is the cohort on leptomeningeal carcinomatosis, we have so few information that even this small number of patients we are testing with the drug will certainly help others to treat patients with leptomeningeal carcinomatosis in HER2 low expressing or HER2 positive breast cancers.